NCLEX-RN Nursing Test Bank. Select all that apply. 1. Question. A patient is admitted to the same-day surgery unit for liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. 1. Partial thromboplastin time. 2. Prothrombin time. 3. Platelet count. 4. Hemoglobin. 5. Complete blood count. 6. White blood cell count. Correct answer: 1, 2, and 3. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. The hemoglobin level, though important information prior to an invasive procedure like liver biopsy, does not assess coagulation.
Two. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Select all that apply. 1. Weight loss. 2. Prolonged clotting time. 3. Hypertension. 4. Headaches. 5. Polyphagia. 6. Pruritus.
Correct answer: 2, 3, and 4. Polycythemia vera is a condition in which the bone marrow produces too many red blood cells. This causes an increase in hematocrit and viscosity of the blood. Patients can experience headaches, dizziness, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time. Weight loss is not a manifestation of polycythemia vera. Generalized pruritus is caused by histamine release due to an increased number of basophils. Patients with polycythemia vera are at increased risk for thromboses that may result in CVAs, strokes, brain attacks, or myocardial infarctions, MEs. Thrombotic complications are the most common cause of death. Bleeding is also a complication, possibly because the platelets are often very large and somewhat dysfunctional. The bleeding can be significant and can occur in the form of nosebleeds, ulcers, frank GI bleeding, hematuria, and intracranial hemorrhage. 3. Question. The nurse is teaching the client how to use a metered dose inhaler, MDI, to administer a corticosteroid drug. Which of the following client actions indicates that he is using the MDI correctly? Select all that apply. 1. The inhaler is held upright. 2. Head is tilted down while inhaling the medication. 3. Client waits 5 minutes between puffs. 4. Mouth is rinsed with water following administration. 5. Client lies supine for 15 minutes following administration. Correct answer: 1 and 4. In using a corticosteroid MDI, remove the cap and hold the inhaler upright, stand or sit up straight, shake the inhaler, tilt your head back slightly, put the inhaler in the mouth, press down on the inhaler quickly, breathe in slowly for 3 to 5 seconds, hold the breath for 10 seconds, breathe out slowly, repeat puffs as prescribed, rinse the mouth, and gargle using water or mouthwash after each use. 4. Question. The nurse is teaching a client with polycythemia vera about potential complications from this disease. Which manifestations would the nurse include in the client's teaching plan? Select all that apply. 1. Hearing loss. 2. Visual disturbance. 3. Headache. 4. Orthopnea. 5. Gout. 6. Weight loss. Correct answer: 2, 3, 4, and 5. Polycythemia vera, a condition in which too many RBCs are produced in the blood serum, can lead to an increase in the hematocrit and hypervolemia, hyperviscosity, and hypertension. Subsequently, the client can experience dizziness, tinnitus, visual disturbances, headaches, or a feeling of fullness in the head. The client may also experience cardiovascular symptoms such as heart failure, shortness of breath and orthopnea, and increased clotting time or symptoms of an increased uric acid level such as painful swollen joints, usually the big toe. Hearing loss and weight loss are not manifestations associated with polycythemia vera. Five. Question. Which of the following would be priority assessment data to gather from the client who has been diagnosed with pneumonia? Select all that apply. 1. Auscultation of breath sounds. 2. Auscultation of bowel sounds. 3. Presence of chest pain. 4. Presence of peripheral edema. 5. Color of nail beds. Correct answer: 1, 3, and 5. A respiratory assessment, which includes auscultation of breath sounds and assessing the color of the nail beds, is a priority for clients with pneumonia. Assessing for the presence of chest pain is also an important respiratory assessment, as chest pain can interfere with the client's ability to breathe deeply. Auscultating bowel sounds and assessing for peripheral edema may be appropriate assessments, but these are not priority assessments for the patient with pneumonia. Six. Question. The nurse is teaching a client who has been diagnosed with TB how to avoid spreading the disease to family members. Which statements by the client indicates that he has understood the nurse's instructions? Select all that apply. 1. I will need to dispose of my old clothing when I return home. 2. I should always cover my mouth and nose when sneezing. 3. It is important that I isolate myself from family when possible. 4. I should use paper tissues to cough in and dispose of them properly. 5. I can use regular plate and utensils whenever I eat. Correct answer: 2, 4, and 5. To avoid the spread of the disease, the client diagnosed with tuberculosis should take all the medicines as they re-prescribed and comply with all the doctor's appointments. Covering the mouth and nose with a tissue when sneezing is also very important. Hand washing should always be observed right after sneezing or coughing. Self-isolation should always be strictly followed, and also stop yourself from using public transportation. Seven. Question. The nurse is admitting a client with hypoglycemia. Identify the signs and symptoms the nurse should expect. Select all that apply. 1. Thirst. 2. Palpitations. 3. Diaphoresis. 4. Slurred speech. 5. Hyperventilation. Correct answer: 2, 3, and 4. Palpitations, an adrenergic symptom, occur as the glucose levels fall, the sympathetic nervous system is activated, and epinephrine and norepinephrine are secreted, causing this response. Diaphoresis is a sympathetic nervous system response that occurs as epinephrine and norepinephrine are released. Slurred speech is a neuroglycopenic symptom. As the brain receives insufficient glucose, the activity of the CNS becomes depressed. Eight. Question. Which adaptations should the nurse caring for a client with diabetic ketoacidosis expect the client to exhibit? Select all that apply. 1. Sweating. 2. Low PCO2. 3. Retinopathy. 4. Acetone breath. 5. Elevated serum bicarbonate. Correct answer, 2 and 4. Metabolic acidosis initiates respiratory compensation in the form of gush malrespirations to counteract the effects of ketone buildup, resulting in a lowered PCO2. A fruity odor to the breath, acetone breath, occurs when the ketone level is elevated in ketoacidosis. Nine. Question. When planning care for a client with ulcerative colitis who is experiencing symptoms, which client care activities can the nurse appropriately delegate to an unlicensed assistant? Select all that apply. 1. Assessing the client's bowel sounds. 2. Providing skin care following bowel movements. 3. Evaluating the client's response to antidiarrheal medications. 4. Maintaining intake and output records. 5. Obtaining the client's weight. Correct answer, 2, 4, and 5. The nurse can delegate the following basic care activities to the unlicensed assistant: providing skin care following bowel movements, maintaining intake and output records, and obtaining the client's weight. Assessing the client's bowel sounds and evaluating the client's response to medication are registered nurse activities that cannot be delegated. Question. Which of the following nursing diagnoses would be appropriate for a client with heart failure? Select all that apply. 1. Ineffective tissue perfusion related to decreased peripheral blood flow secondary to decreased cardiac output. 2. Activity intolerance related to increased cardiac output. 3. Decreased cardiac output related to structural and functional changes. 4. Impaired gas exchange related to decreased sympathetic nervous system activity. Correct answer, 1 and 3. HF is a result of structural and functional abnormalities of the heart tissue muscle. The heart muscle becomes weak and does not adequately pump the blood out of the chambers. As a result, blood pools in the left ventricle and backs up into the left atrium, and eventually into the lungs. Therefore, greater amounts of blood remain in the ventricle after contraction, thereby decreasing cardiac output. In addition, this pooling leads to thrombus formation and ineffective tissue perfusion because of the decrease in blood flow to the other organs and tissues of the body. Typically, these clients have an ejection fraction of less than 50% and poorly tolerate activity. Activity intolerance is related to a decrease, not increase, in cardiac output. Gas exchange is impaired. However, the decrease in cardiac output triggers compensatory mechanisms, such as an increase in sympathetic nervous system activity. Question. When caring for a client with a central venous line, which of the following nursing actions should be implemented in the plan of care for chemotherapy administration? Select all that apply. 1. Verify patency of the line by the presence of a blood return at regular intervals. 2. Inspect the insertion site for swelling, erythema, or drainage. 3. Administer a cytotoxic agent to keep the regimen on schedule even if blood return is not present. 4. If unable to aspirate blood, reposition the client, and encourage the client to cough. 5. Contact the healthcare provider about verifying placement if the status is questionable. Correct answer: 1, 2, 4, and 5. A major concern with the intravenous administration of cytotoxic agents is vessel irritation or extravasation. The Oncology Nursing Society and hospital guidelines require frequent evaluation of blood return when administering vesicant or non-vesicant chemotherapy due to the risk of extravasation. These guidelines apply to peripheral and central venous lines. In addition, central venous lines may be long-term venous access devices. Thus, difficulty drawing or aspirating blood may indicate the line is against the vessel wall or may indicate the line has occlusion. Having the client cough or move position may change the status of the line if it is temporarily against a vessel wall. Occlusion warrants a more thorough evaluation via X-ray study to verify placement if the status is questionable and may require a declotting regimen. Question. A 20-year-old college student has been brought to the psychiatric hospital by her parents. Her admitting diagnosis is borderline personality disorder. When talking with the parents, which information would the nurse expect to be included in the client's history? Select all that apply. 1. Impulsiveness. 2. Lability of mood. 3. Ritualistic behavior. 4. Psychomotor retardation. 5. Self-destructive behavior. Correct answer: 1, 2, and 5. With BPD, the client may engage in harmful, sensation-seeking behaviors, especially when upset. The client may impulsively spend money he or she can't afford, binge eat, drive recklessly, shoplift, engage in risky sex, or overdo it with drugs or alcohol. Unstable emotions and moods are also common with BPD. Ritualistic behavior is common in clients with obsessive-compulsive disorder, OCD. Psychomotor retardation occurs commonly during depressive episodes of bipolar disorder as well as major depressive disorder. When assessing a client diagnosed with impulse control disorder, the nurse observes violent, aggressive, and assaultive behavior. Which of the following assessment data is the nurse also likely to find? Select all that apply. 1. The client functions well in other areas of his life. 2. The degree of aggressiveness is out of proportion to the stressor. 3. The violent behavior is most often justified by the stressor. 4. The client has a history of parental alcoholism and chaotic, abusive family life. 5. The client has no remorse about the inability to control his anger. Correct answer: 1, 2, and 4. A client with an impulse control disorder who displays violent, aggressive, and assaultive behavior generally functions well in other areas of his life. The degree of aggressiveness is typically out of proportion with the stressor. Such a client commonly has a history of parental alcoholism and a chaotic family life, and often verbalizes sincere remorse and guilt for the aggressive behavior. Question. A nurse is caring for a middle-aged client who has undergone hemicolectomy for colon cancer. The client has 2 children. Which concepts about families should the nurse consider when providing care for this client? Select all that apply. 1. Illness in one family member can affect all members. 2. Family roles do not change because of illness. 3. A family member may perform more than one role at a time. 4. Children typically are not affected by adult illness. 5. The effects of an illness on a family depend on the stage of the family's life cycle. 6. Changes in sleeping and eating patterns may be signs of stress in a family. Correct answer: 1, 3, 5, and 6. Illness in one family member can affect all family members, even children. Each member of a family may have several roles to perform. A middle-aged client, for example, may have the roles of father, mother, husband, wife, wage earner, child care provider, and housekeeper. When one family member cannot fulfill a role because of illness, the roles of the other family members are affected. Families move through certain predictable life cycles, such as birth of a baby, a growing family, adult children leaving home, and grandparenting. The impact of illness on the family depends on the stage of the life cycle as family members take on different roles and the family structure changes. Illness produces stress in families. Changes in eating and sleeping patterns are signs of stress. Question. The nurse is monitoring a client receiving peritoneal dialysis and the nurse notes that a client's outflow is less than the inflow. Select actions that the nurse should take. 1. Place the client in good body alignment. 2. Check the level of the drainage bag. 3. Contact the physician. 4. Check the peritoneal dialysis system for kinks. 5. Reposition the client to his or her side. Correct answer: 1, 2, 4, and 5. If outflow drainage is inadequate, the nurse attempts to stimulate outflow by changing the client's position. Turning the client to the other side or making sure that the client is in good body alignment may assist with outflow drainage. The drainage bag needs to be lower than the client's abdomen to enhance gravity drainage. The connecting tubing and the peritoneal dialysis system is also checked for kinks or twisting, and the clamps on the system are checked to ensure that they are open. There is no reason to contact the physician. Question. The nurse is caring for a hospitalized client who has chronic renal failure. Which of the following nursing diagnoses are most appropriate for this client? Select all that apply. 1. Excess fluid volume. 2. Imbalanced nutrition, less than body requirements. 3. Activity intolerance. 4. Impaired gas exchange. 5. Pain. Correct answer: 1, 2, and 3. Appropriate nursing diagnoses for clients with chronic renal failure include excess fluid volume related to fluid and sodium retention, imbalanced nutrition, less than body requirements related to anorexia, nausea, and vomiting, and activity intolerance related to fatigue. The nursing diagnoses of impaired gas exchange and pain are not commonly related to chronic renal failure. 17. Question. The nurse is assessing a child diagnosed with a brain tumor. Which of the following signs and symptoms would the nurse expect the child to demonstrate? Select all that apply. 1. Head tilt. 2. Vomiting. 3. Polydipsia. 4. Lethargy. 5. Increased appetite. 6. Increased pulse. Correct answer: 1, 2, and 4. Head tilt, vomiting, and lethargy are classic signs assessed in a child with a brain tumor. Clinical manifestations are the result of location and size of the tumor. Question. The nurse is caring for a client with a T5 complete spinal cord injury. Upon assessment, the nurse notes flushed skin, diaphoresis above the T5, and blood pressure of 160/96. The client reports a severe, pounding headache. Which of the following nursing interventions would be appropriate for this client? Select all that apply. 1. Elevate the hob to 90 degrees. 2. Loosen constrictive clothing. 3. Use a fan to reduce diaphoresis. 4. Assess for bladder distension and bowel impaction. 5. Administer antihypertensive medication. 6. Place the client in a supine position with legs elevated. Correct answer: 1, 2, 4, and 5. The client has signs and symptoms of autonomic dysreflexia. The potentially life-threatening condition is caused by an uninhibited response from the sympathetic nervous system resulting from a lack of control over the autonomic nervous system. The nurse should immediately elevate the hob to 90 degrees and place extremities dependently to decrease venous return to the heart and increase venous return from the brain. Because tactile stimuli can trigger autonomic dysreflexia, any constrictive clothing should be loosened. The nurse should also assess for distended bladder and bowel impaction, which may trigger autonomic dysreflexia, and correct any problems. Elevated blood pressure is the most life-threatening complication of autonomic dysreflexia because it can cause stroke, ME, or seizures. If removing the triggering event doesn't reduce the client's blood pressure, 4 antihypertensives should be administered. A fan shouldn't be used because cold drafts may trigger autonomic dysreflexia. Question. The nurse is evaluating the discharge teaching for a client who has an ileal conduit. Which of the following statements indicates that the client has correctly understood the teaching? Select all that apply. 1. If I limit my fluid intake, I will not have to empty my ostomy pouch as often. 2. I can place an aspirin tablet in my pouch to decrease odor. 3. I can usually keep my ostomy pouch on for 3 to 7 days before changing it. 4. I must use a skin barrier to protect my skin from urine. 5. I should empty my ostomy pouch of urine when it is full. Correct answer: 3 and 4. The client with an ileal conduit must learn self-care activities related to care of the stoma and ostomy appliances. The client should be taught to increase fluid intake to about 3,000 milliliters per day and should not limit intake. Adequate fluid intake helps to flush mucus from the ileal conduit. The ostomy appliance should be changed approximately every 3 to 7 days and whenever a leak develops. A skin barrier is essential to protecting the skin from the irritation of the urine. Aspirin should not be used as a method of odor control because it can be an irritant to the stoma and lead to ulceration. The ostomy pouch should be emptied when it is 1/3 to 1/2 full to prevent the weight from pulling the appliance away from the skin. Question. A nurse is assisting in performing an assessment on a client who suspects that she is pregnant and is checking the client for probable signs of pregnancy. Select all probable signs of pregnancy. 1. Uterine enlargement. 2. Fetal heart rate detected by a non-electric device. 3. Outline of the fetus via radiography or ultrasound. 4. Chadwick-Hess sign. 5. Braxton Hicks contractions. 6. Ballottement. Correct answer: 1, 4, 5, and 6. The probable signs of pregnancy include uterine enlargement, Heger's sign or softening and thinning of the uterine segment that occurs at week 6. Goodell's sign or softening of the cervix that occurs at the beginning of the 2nd month. Chadwick-Hess sign or bluish coloration of the mucous membranes of the cervix, vagina, and vulva occurs in week 6. Ballottement or rebounding of the fetus against the examiner's fingers of palpation. Braxton Hicks contractions. Positive pregnancy test measuring for HCG. Positive signs of pregnancy include fetal heart rate detected by electronic device, Doppler, at 10-12 weeks. Fetal heart rate detected by non-electronic device, fetoscope, at 20 weeks OG. Active fetal movement palpable by the examiners. Outline of the fetus via radiography or ultrasound. Question. A nurse is monitoring a pregnant client with pregnancy-induced hypertension who is at risk for preeclampsia. The nurse checks the client for which specific signs of preeclampsia? Select all that apply. 1. Elevated blood pressure. 2. Negative urinary protein. 3. Facial edema. 4. Increased respirations. Correct answer: 1 and 3. The 3 classic signs of preeclampsia are hypertension, generalized edema, and proteinuria. Increased respirations are not a sign of preeclampsia. Question. A nurse is caring for a pregnant client with severe preeclampsia who is receiving 4 magnesium sulfate. Select all nursing interventions that apply in the care for the client. 1. Monitor maternal vital signs every 2 hours. 2. Notify the physician if respirations are less than 18 per minute. 3. Monitor renal function and cardiac function closely. 4. Keep calcium gluconate on hand in case of a magnesium sulfate overdose. 5. Monitor deep tendon reflexes hourly. 6. Monitor I&Os hourly. 7. Notify the physician if urinary output is less than 30 milliliters per hour. Correct answer: 3, 4, 5, 6, and 7. When caring for a client receiving magnesium sulfate therapy, the nurse would monitor maternal vital signs, especially respirations, every 30-60 minutes and notify the physician if respirations are less than 12, because this would indicate respiratory depression. Calcium gluconate is kept on hand in case of magnesium sulfate overdose, because calcium gluconate is the antidote for magnesium sulfate toxicity. Deep tendon reflexes are assessed hourly. Cardiac and renal function is monitored closely. The urine output should be maintained at 30 milliliters per hour because the medication is eliminated through the kidneys. (23) Question. When interpreting an ECG, the nurse would keep in mind which of the following about the P wave. Select all that apply. 1. Reflex electrical impulse beginning at the synode. 2. Indicated electrical impulse beginning at the avenue node. 3. Reflex atrial muscle depolarization. 4. Identifies ventricular muscle depolarization. 5. Has duration of normally 0.11 seconds or less. Correct answer: 1, 3, and 5. In a client who has had an ECG, the P wave represents the activation of the electrical impulse in the synode, which is then transmitted to the avenue node. In addition, the P wave represents atrial muscle depolarization, not ventricular depolarization. The normal duration of the P wave is 0.11 seconds or less in duration and 2.5 millimeters or more in height. (24) Question. When caring for a client with a central venous line, which of the following nursing actions should be implemented in the plan of care for chemotherapy administration? Select all that apply. 1. Verify patency of the line by the presence of a blood return at regular intervals. 2. Inspect the insertion site for swelling, erythema, or drainage. 3. Administer a cytotoxic agent to keep the regimen on schedule even if blood return is not present. 4. If unable to aspirate blood, reposition the client, and encourage the client to cough. 5. Contact the healthcare provider about verifying placement if the status is questionable. Correct answer: 1, 2, 4, and 5. A major concern with intravenous administration of cytotoxic agents is vessel irritation or extravasation. The Oncology Nursing Society and hospital guidelines require frequent evaluation of blood return when administering vesicant or non-vesicant chemotherapy due to the risk of extravasation. These guidelines apply to peripheral and central venous lines. In addition, central venous lines may be long-term venous access devices. Thus, difficulty drawing or aspirating blood may indicate the line is against the vessel wall or may indicate the line has occlusion. Having the client cough or move position may change the status of the line if it is temporarily against a vessel wall. Occlusion warrants more thorough evaluation via X-ray study to verify placement if the status is questionable and may require a declotting regimen. 25. Question. A nurse is assessing a newly admitted client. In the family assessment, who should be considered as part of the client's family? Select all that apply. 1. People related by blood or marriage. 2. People whom the client views as family. 3. People who live in the same house. 4. People whom the nurse thinks are important to the client. 5. People of the same racial background who live in the same house as the client. 6. People who provide for the physical and emotional needs of the client. Correct answer, 2 and 6. Rationale. When providing care to a client, the nurse should consider family members to be all the people whom the client views as family. Family members may also include those people who provide for the physical and emotional needs of the client. The traditional definition of a family has changed and may include people not related by blood or marriage, those of a different racial background, and those who may not live in the same house as the client. Family members are defined by the client, not by the nurse. (26) Question. The nurse recognizes that a client is experiencing insomnia when the client reports. Select all that apply. 1. Extended time to fall asleep. 2. Falling asleep at inappropriate times. 3. Difficulty staying asleep. 4. Feeling tired after a night's sleep. Correct answer, 1, 3, and 4. These symptoms are often reported by clients with insomnia. Clients report non-restorative sleep. Arising once at night to urinate, nocturia, is not in and of itself insomnia. (27) Question. The nurse teaches the mother of a newborn that in order to prevent sudden infant death syndrome, SIDS, the best position to place the baby after nursing is? Select all that apply. 1. Prone. 2. Side lying. 3. Supine. 4. Fowlers. Correct answer, 2 and 3. Research demonstrates that the occurrence of SIDS is reduced with these two positions. 28. Question. A client has a diagnosis of primary insomnia. Before assessing this client, the nurse recalls the numerous causes of this disorder. Select all that apply. 1. Chronic stress. 2. Severe anxiety. 3. Generalized pain. 4. Excessive caffeine. 5. Chronic depression. 6. Environmental noise. Correct answer, 1, 4, and 6. Acute or primary insomnia is caused by emotional or physical discomfort not caused by the direct physiologic effects of a substance or a medical condition. Excessive caffeine intake is an example of disruptive sleep hygiene. Caffeine is a stimulant that inhibits sleep. Environmental noise causes physical and/or emotional and therefore is related to primary insomnia. (29) Question. The use of barbiturates in treating insomnia include which of the following? Select all that apply. 1. Barbiturates deprive people of REM sleep. 2. Barbiturates deprive people of REM sleep. 3. When the barbiturates are discontinued, then REM sleep increases. 4. When the barbiturates are discontinued, the REM sleep increases. 5. Nightmares are often an adverse effect when discontinuing barbiturates. Correct answer: 2, 4, and 5. Barbiturates deprive people of REM sleep. When the barbiturate is stopped and REM sleep once again occurs, a rebound phenomenon occurs. During this phenomenon, the person's dream time constitutes a larger percentage of the total sleep pattern, and the dreams are often nightmares. Question: which of the following is appropriate when there is a benzodiazepine overdose? Select all that apply. 1. Administration of syrup of ipecac. 2. Gastric lavage. 3. Activated charcoal and a saline cathartic. 4. Hemodialysis. 5. Administration of flumazenil. Correct answer: 2, 3, and 5. If ingestion is recent, the decontamination of the GI system is indicated. The administration of syrup of ipecac is contraindicated because of aspiration risks related to sedation. Gastric lavage is generally the best and most effective means of gastric decontamination. Activated charcoal and a saline cathartic may be administered to remove any remaining drug. Hemodialysis is not useful in the treatment of benzodiazepine overdose. Flumazenil can be used to acutely reverse the sedative effects of benzodiazepines, though this is normally done only in cases of extreme overdose or sedation. Question: a 6-year-old child with leukemia is hospitalized and is receiving combination chemotherapy. Laboratory results indicate that the child is neutropenic, and the nurse prepares to implement protective isolation procedures. Which interventions would the nurse initiate? Select all that apply. 1. Restrict all visitors. 2. Place the child on a low-bacteria diet. 3. Change dressings using sterile technique. 4. Encourage the consumption of fresh fruits and vegetables. 5. Perform meticulous hand washing before caring for the child. 6. Allow fresh cut flowers in the room as long as they are kept in a vase with fresh water. Correct answer: 2, 3, and 5. For the hospitalized neutropenic child, flowers or plants should not be kept in the room because standing water and damp soil harbor aspergillus and pseudomonas, to which these children are very susceptible. Fruits and vegetables not peeled before being eaten harbor molds and should be avoided until the white blood cell count rises. The child is placed on a low bacteria diet. Dressings are always changed with sterile technique. Not all visitors need to be restricted, but anyone who is ill should not be allowed in the child's room. Meticulous hand washing is required before caring for the child. In addition, gloves, a mask, and a gown are worn, per agency policy. 32. Question. A 16-year-old child is brought to the emergency department by his mother with a complaint that the child just experienced a tonic-clonic seizure. On arrival in the emergency department, no apparent seizures were occurring. The mother states that her son is taking medication for the seizure disorder. The nurse plans care, knowing that which of the following medications are used for long-term control of tonic-clonic seizures? Select all that apply. 1. Diazepam, Valium. 2. Alprazolam, Xanax. 3. Gabapentin, Neuron. 4. Ethosuximide, Zeron. 5. Carbamazepine, Tegretol. 6. Methylphenidate, Ritalin. Correct answer, 3, 4, and 5. Medications that are prescribed for long-term control of tonic-clonic seizures are gabapentin, ethosuximide, and carbamazepine. Diazepam is a medication that is prescribed to halt tonic-clonic episodes, and methylphenidate is a medication used to treat attention deficit hyperactivity disorder. Both of these medications are not suitable for long-term control of a seizure condition. Alprazolam is a medication used to treat anxiety. Question. A child has been diagnosed with meningococcal meningitis. Which of the following isolation techniques is appropriate? 1. Enteric precautions. 2. Neutropenic precautions. 3. No precautions are required as long as antibiotics have been started. 4. Isolation precautions for at least 24 hours after the initiation of antibiotics. 5. Droplet precautions, private room, mask for all entering the room, until they have completed 24 hours of appropriate antibiotic therapy. 6. Negative pressure ventilation is not required. Correct answer, 4, 5, and 6. Meningococcal meningitis is transmitted primarily by droplet infection. Isolation is begun and maintained for at least 24 hours after antibiotics are given. Negative pressure ventilation is not required. Patients with pneumococcal or viral meningitis do not require isolation. Options 1, 2, and 3 are incorrect. Question. A client enters the emergency department confused, twitching, and having seizures. His family states he recently was placed on corticosteroids for arthritis and was feeling better and exercising daily. On data collection, he has flushed skin, dry mucous membranes, an elevated temperature, and poor skin turgor. His serum sodium level is 172 mg. Choose the interventions that the healthcare provider would likely prescribe. Select all that apply. 1. Monitor intake and output. 2. Monitor vital signs. 3. Maintain a sodium-reduced diet. 4. Monitor electrolyte levels. 5. Increase water intake orally. 6. Administer sodium replacements. Correct answer, 1, 2, 3, 4, and 5. Hypernatremia is described as having a serum sodium level that exceeds 145 mg. L signs and symptoms would include dry mucous membranes, loss of skin turgor, thirst, flushed skin, elevated temperature, oliguria, muscle twitching, fatigue, confusion, and seizures. Interventions include monitoring fluid balance, monitoring vital signs, reducing dietary intake of sodium, monitoring electrolyte levels, and increasing oral intake of water. Sodium replacement therapy would not be prescribed for a client with hypernatremia. (35) Question. A client has died, and a nurse asks a family member about the funeral arrangements. The family member refuses to discuss the issue. The nurse's appropriate action is to 1. Show acceptance of feelings. 2. Provide information needed for decision making. 3. Suggest a referral to a mental health professional. 4. Remain with the family member without discussing funeral arrangements. 5. Let the family slowly acknowledge its impact. Correct answer, 4 and 5. The family member is exhibiting the first stage of grief, denial, and the nurse should remain with the family member. As the family moves through the experience and slowly acknowledges its impact, the initial denial and disbelief fade. Option 1 is an appropriate intervention for the acceptance or reorganization and restitution stage. Option 2 of may be an appropriate intervention for the bargaining stage. Option 3 of may be an appropriate intervention for depression. (36) Question. A client is scheduled for a myelogram, and the nurse provides a list of instructions to the client regarding preparation for the procedure. Which instructions should the nurse place on the list? Select all that apply. 1. Jewelry will need to be removed. 2. An informed consent will need to be signed. 3. A trained X-ray technician performs the procedure. 4. The procedure will take approximately 45 minutes. 5. A liquid diet can be consumed on the day of the procedure. 6. Solid food intake needs to be restricted only on the day of the procedure. Correct answer, 1, 2, and 4. Client preparation for a myelogram includes instructing the client to restrict food and fluids for 4 to 8 hours before the procedure. The client is told that the procedure takes about 45 minutes. An informed consent is required because the procedure is invasive and is therefore performed by the healthcare provider. The client will need to remove jewelry and metal objects from the chest area. The client is also told that pre-test medications may be prescribed for relaxation. (37) Question. A client with a closed head injury is receiving phenytoin, Dilantin, an anticonvulsant medication. Which of the following would indicate that the client is experiencing side effects related to this medication? Select all that apply. 1. Ataxia. 2. Sedation. 3. Constipation. 4. Bleeding gums. 5. Hyperglycemia. 6. Decreased platelet count. Correct answer, 3, 4, 5, and 6. Dilantin causes blood dyscrasias, such as decreased platelet counts and decreased white blood cell counts. It contributes to constipation as well. Gingival hyperplasia can occur, causing gums to bleed easily, and blood glucose levels can elevate when taking phenytoin. Sedation is a side effect of barbiturates, not phenytoin. Ataxia is a side effect of benzodiazepines. Question. A client with carcinoma of the lung develops the syndrome of inappropriate antidiuretic hormone, SIAD, as a complication of the cancer. The nurse anticipates that which of the following may be prescribed? Select all that apply. 1. Radiation. 2. Chemotherapy. 3. Increased fluid intake. 4. Serum sodium blood levels. 5. Decreased oral sodium intake. 6. Medication that is antagonistic to antidiuretic hormone, ADH. Correct answer: 1, 2, 4, and 6. Cancer is a common cause of SIAD. In clients with SIAD, excessive amounts of water are reabsorbed by the kidney and put into the systemic circulation. The increased water causes hyponatremia, decreased serum sodium levels, and some degree of fluid retention. SIAD is managed by treating the condition and its cause, and treatment usually includes fluid restriction, increased sodium intake, and a medication with a mechanism of action that is antagonistic to ADH. Sodium levels are monitored closely because hypernatremia can suddenly develop as a result of treatment. The immediate institution of appropriate cancer therapy, usually either radiation or chemotherapy, can cause tumor regression so that ADH synthesis and release processes return to normal. Question. The nurse is preparing to teach a client about the prescribed spironolactone, aldactone, to monitor for adverse effects of the drug. The nurse should instruct the client about which adverse effects? Select all that apply. 1. Confusion. 2. Fatigue. 3. Hypertension. 4. Leg cramps. 5. Weakness. 6. Urinary retention. Correct answer: 1, 2, and 5. Spironolactone, aldactone, is used to treat hypertension and edema by removing excess fluid. Aldactone is known as a potassium-sparing diuretic. Confusion, fatigue, and weakness are signs of hyperkalemia, an adverse effect of spironolactone. Spironolactone is used to treat hypertension, so it would not produce this effect. Leg cramps are an adverse effect of hypokalemia. Urinary retention is a side effect of anticholinergics. Question. The clinic nurse is assisting to perform a focused data collection process on a client who is complaining of symptoms of a cold, a cough, and lung congestion. Which of the following would the nurse include for this type of data collection? Select all that apply. 1. Auscultating lung sounds. 2. Obtaining the client's temperature. 3. Checking the strength of peripheral pulses. 4. Obtaining information about the client's respirations. 5. Performing a musculoskeletal and neurological examination. 6. Asking the client about a family history of any illness or disease. correct answer, 1, 2, and 4. A focused data collection process focuses on a limited or short-term problem, such as the client's complaint. Because the client is complaining of symptoms of a cold, a cough, and lung congestion, the nurse would focus on the respiratory system and the presence of an infection. A complete data collection includes a complete health history and physical examination and forms a baseline database. Checking the strength of peripheral pulses relates to a vascular assessment, which is not related to this client's complaints. A musculoskeletal and neurological examination also is not related to this client's complaints. However, the strength of peripheral pulses and a musculoskeletal and neurological examination would be included in a complete data collection. Likewise, asking the client about a family history of any illness or disease would be included in a complete assessment.